Hello, I'm Malabika Sarker, Professor of the Practice and Associate Dean for Global Engagement at Brown School of Public Health, Brown University. The theme of the World Congress on Public Health in South Africa is Health Without Border. And my expectation for the conference is the deeper discussion on two topics which I'm going to touch. The first topic I would like to discuss about how we define evidence or knowledge. Although we are critical about the epistemic aspect of the knowledge generation, such as who generated like elite group and how, particularly through randomized control trials, but we treat what implementers know as somehow less rigorous, less valid, and tacit knowledge or simply anecdotal. And those information we collect from implementers are only valid when we researcher collect using a quantitative or qualitative approach, relying on rigorous method or design. But implementers are not just delivering the program, they are generating knowledge every single day. When a community health worker notices that a certain message is accepted differently by one population than another, that is data. When a program manager adopts an intervention component because the original design did not fit the local context and it works, that is evidence. When a practitioner builds trust with a community over the years and that trust becomes the reason people show up for care, that is something no trial can manufacture or fully measure. And here's what I think is critical. Even the most rigorous, well-designed randomized control trial cannot replicate that everyday knowledge. Implementers are working in the real world with real complexity, and what they learn, that is irreplaceable. So I think that we need to create a structure that encourage implementers and practitioners to document what they observe, adapt, and learn. Not only collect those information through the research, but they will document it. And we need spaces like this conference in South Africa where the knowledge will be shared, discussed, and taken seriously. But at the same time, we also need policymakers and the funders to treat those knowledge as legitimate when designing new intervention, because that process and learning can be shared also by the countries with similar resources or similar settings. The second issue I want to raise is a discussion on fundamental reframing of how we think about global health. And it is kind of connected with what I said about implementers' knowledge. Global health often operates on a charity model. And the underlying logic is, they are a vulnerable population, they are suffering, and we, those with the resources, whether outside the country or within the country, with expertise and power, will intervene to help him. We know that it comes from a good place. It's not malicious or bad intended, but it is ultimately limited, and it's a limiting framework. So we need to ask the harder question that why are this population vulnerable in the first place? And that is a question the justice model demands. It does not start with that, how do we help? It starts with how was the inequity created? So, and the next question comes, who is accountable for reversing it? That is a completely different conversation because it shifts the frame from generosity to responsibility, from aid to accountability. And this is important because when we ask root cause question, we get very different answer, different intervention, and different measures of success. Because I think that's why the decolonization in global health becomes concrete, because decolonization is not just an intellectual debate. It is about who holds the power to define the problem, design solution, and determine what counts as success. And only a justice model can answer that. And that is why, exactly like my previous point, matters so much here. Because shifting towards justice model from the charity model requires that knowledge and evidence be locally produced and generated from bottom up, not the elite of the country, but by the communities and implementers who are closest to the problem. It's not should be handed down from the top through the external framework or methodological preference or rigorous design, longitudinal data. It is about who gets to know and who is knowing counts.